Hi, my name is Stephen Epstein. I'm 36 years old, live in Nashville, and I recently had stem cell therapy done on my broken ankle. I was kite surfing in the Dominican Republic, and I literally shattered my heel. It was really pretty bad, and the doctors told me that I was going to have surgery, and but yet my ankle was really too inflamed to get the surgery, and I really wanted to avoid the surgery if it was all possible. So I opted to go without the surgery and kind of let it heal by itself and see how it did. And about over a year went by, and I was still experiencing a tremendous amount of pain when I was walking, and I was really seriously considering getting the surgery because I was experiencing so much pain. I said I was having arthritis in the joint in my heel, my right heel, and so I went and got stem cell because I thought I'd try that before I got the surgery, and it took about 2 or 3 months for it to kick in, but man, can I tell you the improvement that I got was incredible. I'd probably say I got about a 70% reduction in the amount of pain that I experience. It's still sore from time to time, but really nothing what it was like. It did, however, take a couple months to come into effect, but I've been telling everybody I know that stem cell therapy is legitimate, it's real, it works. It's so much better than getting surgery. My God, I got an injection and then was walking around, later that afternoon. Obviously, you want to take care of your injury and nurse it back to health, but and stay off of it to let the stem cells do their magic. But it's really remarkable and highly worth it. Even if insurance doesn't cover it, which it doesn't, it's so well worth it if you're suffering from chronic pain or a chronic injury of any kind. So anyway, I can't really recommend stem cell therapy more highly. I'll be using it in the future if I ever have any kind of injury or chronic pain again. So yeah, I would highly encourage you to at least give it a shot and see how it works. Because man, has it bailed me out of a real tough situation. So.
Hi, I'm Dr. David Morris at Magnolia Medical Center, and I want to welcome you to my presentation on stem cell therapy. We're excited to be one of the first clinics in Middle Tennessee to offer this revolutionary technique for healing, and I want to make sure our patients are educated on this. In this presentation, I'll explain what stem cells are, and what condition they're used to help. I will go over the different types and sources of stem cells, that's important. And I'm going to cover what therapies our office uses to maximize the benefits of stem cell therapy. So other therapies that can be done to maximize what stem cells can do. And I'm going to go over with you how to decide if you might be a candidate for stem cell therapy and what would disqualify someone from being a candidate for care in our office. Also covered in this video is the cost of therapy, what someone should do after watching this video, and how to schedule an appointment in our office. So, let's get started. The first thing you should know about me is that I'm a chiropractor. Now, we're not a chiropractic clinic, we're a medical clinic, but some might say, well, what is a chiropractor doing talking about stem cell therapy, and what makes him qualified to talk about it? Well, at the time of making this video, I've been in private practice for over 20 years. My whole career has been dedicated to helping people solve health problems without the use of harmful drugs and surgeries. I spent countless hours researching what is proven to be some of the most innovative and promising natural treatments for health problems that are known about in the world today. I started out my career treating patients with chiropractic as my only tool, but I always was curious about what other natural methods are there out there that can help someone, and I realized that there were things out there that were really changing people's lives, but they needed to be done by somebody with a different degree than I had, somebody with a medical degree or a background. So, as more natural healthcare providers like we have in our office, our goal is to get to the bottom of a patient's condition and resolve the underlying reasons why something isn't going right, why they're not healthy, why they're suffering. At our office, we do not work just to handle symptoms. I'm a strong believer in integration, integrating different professions, different people, professionals, as the best model, providing the best patient care. And for this reason, we put together a team of nurse practitioners, chiropractors, therapy assistants, massage therapists, and a medical doctor to oversee everything, all with one purpose, and that is providing the best non-drug, non-surgical pain care that a patient can get in Middle Tennessee. As the saying goes, teamwork is dream work. All right, so that explains who we are, and I hope the model makes sense to you. We really feel like this type of model is the future of medicine. So let's get started into stem cells. The first question is, what is a stem cell? Well, stem cells are essentially the cells that make up everything else. They're the building blocks of your body. You have stem cells right now that are working to help repair and replace all kinds of cells in your body. The thing that makes stem cells very unique is that they're able to become any other kind of cell in the body. Imagine a little kid who hasn't decided what he wants to be when he grows up. He could be anything. He could be a pilot, he could be an accountant or a doctor or a teacher. He just hasn't specialized yet. That's what a stem cell is like. It hasn't specialized yet. So basically, every other cell in the body stems from this type of cell, hence stem cell. Now, a stem cell does two things. Number one, it can specialize into a particular type of cell in the body, a heart cell, a muscle cell, or a bone cell. Number two, really important, it self-renews and makes more stem cells. So, you start here with a stem cell, right? And let's say this is a skin stem cell. And your skins fall off your body and they die and they have to be regenerated, and actually they have to be regenerated at a very rapid rate. Well, beneath your skin cells are stem cells which are doing these two things. They're self-renewing, making more stem cells, and they're creating and specializing into skin cells as you need them. This is important to keep in mind as we move through this presentation. Stem cells renew themselves and they specialize. Next, where do stem cells come from? And I'll tell you that this is where some of the controversy enters into the stem cell debate. So if you've heard that stem cells are controversial, this is why. I want you to know that we do not work with any stem cells that have the potential to harm new life. But I do want to cover where they typically come from, okay? But we don't do anything that harms new life. There are two types of stem cells. First are embryonic stem cells. These are the more controversial ones. And then there are somatic stem cells, or adult or tissue stem cells. So we're going to describe each one here. All right, going back to health class, embryonic stem cells are exactly what they sound like. They're stem cells that are gotten from embryos. So let's be clear what that means. You've got the sperm and the egg, and they come together, fertilization occurs, the cells begin to divide, and at that point, when the cells have split about 4 times, the embryo begins to develop stem cells. At about 5 to 8 days past fertilization, the developing embryo is called a blastocyst. And there are a good number of stem cells available in that blastocyst. And these are the stem cells that most researchers are using in their scientific study. So that begs the question, where do these embryos come from? Well, in fact, current research studies that are federally funded in the United States obtain their embryonic stem cells from in vitro fertilization clinics, not from abortion clinics like many people think. These clinics typically fertilize an excess of sperms and eggs for a potential mother or father who's looking for in vitro fertilization. And after the couple has had a successful implantation of the embryo or multiple embryos into the womb, the extra embryos can then be donated for scientific research. Now, these embryonic stem cells are not what are used for therapy treatments such as what we do in our office and even what other stem cell clinics use with patients. There is still some controversy surrounding these embryos and at what point life ensues. And that's an understandable debate, but it's not a debate that we're going to take up on this video. Just know that the stem cells used in our clinic are not embryonic stem cells. So what do we use? We use adult stem cells or somatic stem cells. These are stem cells that come from a few different places. A patient can have his own blood drawn and have it spun down and get stem cells from that. There aren't a ton of stem cells available in blood itself, so that's not a great way to obtain stem cells. There are stem cells in adipose or fat tissue. These stem cells are obtained by a procedure similar to liposuction, where the fat is drawn out of the body and spun down to obtain the stem cells in the tissues. A third option is they draw stem cells out of the bone marrow, someone's bone marrow, and then they spin the bone marrow down, the blood in the bone marrow down, and get stem cells from that. A fourth option is to obtain stem cells is from the placenta and cord blood, which is donated after a scheduled C-section delivery. These stem cells are obtained from the tissues and spun down for use in stem cell treatments. So what is the difference and which is better? Well, embryonic stem cells are a special type of stem cell that can become nearly any type of other cell in the body, which makes sense given that they're from an embryo. Adult stem cells, including cord blood and placental stem cells, which are called amniotic stem cells, can become some, but not all types of cells in the body. And these are used mainly in treatment therapies. As an example, embryonic stem cell research is looking into embryonic stem cells for neurological disorders like Parkinson's disease. Embryonic stem cells can become nerve cells. Adult stem cells aren't a good choice for that type of treatment. So let's talk about potential treatments for a minute. Why are doctors and scientists so interested in stem cells? So there's so much news about this if you're paying attention to these studies. The reason for this is that stem cells can repair damaged tissue that cannot heal itself. It's really exciting. This has the potential to treat conditions like spinal cord injuries, type 1 diabetes, heart disease, blood disorders, cancers, burns, neurological disorders like MS or Parkinson's, and disorders that we specialize in treating here at Magnolia Medical Center, such as musculo-skeletal disorders. So what does a stem cell treatment or stem cell therapy entail? As we went over in an earlier slide, there are a few different ways to obtain adult stem cells. Blood, bone marrow, and adipose tissue. Those are obtained, and treatment is done through something called auto, meaning self-logous therapy. In this therapy, stem cells are collected in the doctor's office. The tissue is drawn out of the bone or the fat tissue or the blood of the individual. It's spun down in the office and then re-injected into the patient right there in the office. It usually involves a few different appointments to make that all happen. This is not what we do in our office. The alternative to this is homo, meaning same, logous therapy, homologous therapy. And that's where stem cells are already collected from a placenta and cord blood, minimally processed, shipped to the doctor's office, and then injected into the patient. That's what we do in our office. There are a few reasons that we opted for this type of stem cell therapy. First is that it's very effective. The fact is that placental and cord blood stem cells are very young stem cells. Second is that it is easier on the provider and, more importantly, the patient. No in-office procedure to draw bone marrow from the femur or liposuction that's needed for fat cells. Third is that it's more cost-effective for patients. So, what exactly you're getting in a stem cell injection that we do in our office? And folks, it's not just stem cells. The injection that we use in our office is a bit of a soup of elements designed to help your body heal, including collagen substrates, the full range of growth factors that your cells need to heal and grow, amino acids, carbohydrates, cytokines, which are little chemical messengers which your cells use to communicate, hyaluronic acid, which is another building block for cartilage, fibroblasts, which are other type of building cells, epithelial cells, what's something called extracellular matrix, micronize the amniotic membrane, and mesenchymal stem cells. These are the type of cells that are the best to use in rebuilding bone, muscle, ligament, tendon, cartilage, and skin. If you have any of these conditions, stem cell therapy could be a treatment option for you, very viable treatment option for you. So knee pain, osteoarthritis of the knee arthritis, or arthritis anywhere in the body really, patellofemoral syndrome, Osgood-Schlatter, knee stiffness or weakness, knee swelling, or any joint swelling, wrist pain, shoulder stiffness, frozen shoulder, rotator cuff issues. We've seen people with torn meniscus in their knee. We've had patients with torn ligaments and tendons, hip pain, hip degeneration, hip arthritis, elbow pain, tennis elbow, high ankle sprains, unhealing bones, ankle pain. So many different symptoms can be helped and actually not just helped but even healed from this type of therapy. Many of you have probably tried some or other types of treatments for these conditions and gotten some relief or maybe no relief. Maybe you've been told you'll just have to live with it, or you provided some type of prescriptive therapy, meaning medicinal or medication therapy for your symptoms, but it's not solving the problem. Some of you have even been told that surgery is your only option, And I need to take a few minutes to talk about that. All right. There are definitely times when surgery is the best option. I even advised my own father-in-law to pursue surgery for his neck problem, and I'm a chiropractor. It was the best thing to do for him given his condition. However, study after study after study has shown that when being consulted by a surgeon on whether or not surgery is the best option, generally speaking, surgery is what will be recommended. So when you have a hammer, things look like a nail, right? So a broad data study was done which looked into the vast increase in the numbers of orthopedic surgeries. The study was looking for a common factor which would explain the increase in numbers of surgery in some areas in the country over other areas and the general increase in surgery overall. Want to know what they found? The one common factor that determined which areas had a higher incidence of surgery was the number of surgeons in that area. That was it. It wasn't the number of problems, but the number of surgeons. So let's take a look at a few other studies that were done since the year 2000. In 2002, the New England Journal of Medicine published a study which showed that arthroscopic knee surgery for arthritic knees produced the same result as patients who had what they call a sham or pretend surgery. These patients signed up to be part of a study. Half were given a real surgery, the other half were given a pretend surgery. They didn't know which one they got. The patient didn't know. The outcome was the same. In 2008, another one, New England Journal of Medicine, published a study which found that outcomes for arthroscopic knee surgery were the same as patients who had only physical therapy. The conclusion was that surgery was not a better option there either. Now again in 2013, same journal of medicine, published a study which found that the outcomes for patients receiving surgery after a meniscus tear of the knee to be the same as patients who had a pretend surgery. So people went in thinking they were going to get a meniscus surgery, half did, half didn't. The gist of that outcome was questionable. All right, add to that the risk, complications of surgery, including infection, no results, pain, blood clots, nerve damage, prescriptive addictive medication, or worse. And not to mention the cost of the surgeries, like $20, $30, $50, $100,000, and not to mention the missed work and activities that go along with that. So is surgery an option? The truth is sometimes, but usually it's unnecessary and of marginal benefit. And again, I'm not saying surgery is never warranted, but I know with certainty that reinvigorating your own body's own healing mechanism is one of the best alternatives to surgery today. Stem cell therapy has no serious complications, no downtime, no painful recovery. The benefits of stem cell therapy include decreased pain, decreased inflammation, increased range of motion, ongoing healing, which we're going to talk about in a minute. That's really exciting. No missed work, no scar tissue buildup, no pain medication or risk of addiction, and positive long-term benefits. So let's talk about the long-term benefits of stem cell therapy. Realize that your body already has stem cells in it, and those stem cells are there to help regenerate your tissues. But if they're tired, or you're not producing enough of them now, enough stem cells, and you could have likely suppressed their function with things like ibuprofen and Aleve or other pain medication, by providing you with new stem cells into an injured area, you provide your best chance of healing your own body. Now, one thing you should know about stem cell therapy is that it is an ongoing treatment. Not that you come to the office for ongoing treatment, but rather that the process continues on your body after you get an injection. If your body is working to repair some tissue, it won't be repaired by just one or a few stem cells. It will be new cells after new cells after new cells. And most patients begin to see noticeable results in the first few weeks. After 6 months, patients are reporting 50% improvement. After 24 months, it's as high as 60 and 70%, and even improvement continuing up to 3 years later, up to 70, 80%. So patients are getting better and better and better, even after their injection. One of the things that makes this therapy so exciting is that it's the only therapy that continues to show improvement after the fact. Compare this to surgery, in which the best a person will be is right after the surgery heals and the person does their rehab, and then the body's going to start to degenerate again. Okay, what are the benefits of doing stem cell therapy in an office like ours? Well, folks, we're a full service, we're non-drug, and a non-surgery clinic. It's our goal, it's our passion to help patients get out of pain without the use of surgery or addictive medications. We do full, individually tailored physical rehab. We provide chiropractic care for those who need it. And we could do other types of therapy. typically non-steroidal injections. We can do massage therapy in our office as well. And in addition to these more traditional types of therapies that many of you have heard about for pain, we're also one of the only clinics in Middle Tennessee which offers pulsed electromagnetic field therapy or cellular exercise. Aside from stem cell therapy, this could be some of the most incredible therapy available today. This is the standard of care in Europe post-surgery. It is actually used right in hospitals in Europe. It is FDA approved to assist in the healing of broken bones in this country. The machine works to contract and relax the cells so that nutrients can get pulsed into the cells and toxins get flushed out of the cells. This increases the healing potential of your cells. We've had our cellular exercise machines in our office for about a year now, and we're seeing amazing results with this therapy. We're eliminating patients' knee pain, fixing frozen shoulders, even improving cellular response to diabetes and lowering patients' A1C. It is used to improve circulation and cellular metabolism. By definition, cellular metabolism is the rate at which the cell repairs. Essentially, it recharges the cells of your body. It's a really, really amazing therapy, and it's something we can do in addition to stem cell. This is actually one of the reasons we're so excited to be delivering stem cell therapy, because with those two cutting-edge treatments, patients can truly heal and get their lives back. Okay, now, what are some conditions that would disqualify someone for stem cell therapy in our office? Well, if a patient has leukemia or other blood-borne cancer, if a patient takes Coumadin or other blood thinners, or if a patient is currently undergoing treatment for cancer. That's it for contraindications, folks. Not much, all right? Now, some frequently asked questions. First, is this FDA approved? The FDA approves or disapproves only drugs and devices. Stem cells are neither a drug or a device. So FDA approval doesn't come into play, just like the FDA doesn't approve if you donated blood. Now, with that said, because we're dealing with human tissues, there are other regulatory bodies that make sure the facilities which collect and then dispense the tissues are properly caring for those tissues and people are properly screened as they donate. The facility that we use is accredited by the American Association of Tissue Banks. Is there any risk of my body rejecting the stem cells? The short answer is no. The stem cells that we use do not have a substance called HLA, which is a protein found in most cells of your body and is typically used to find a match when we're talking about bone marrow or organ donation. Because stem cells don't contain HLA, there is no risk of rejection. Folks, is this service covered by my insurance? I think you know the answer to this already, as most of my patients that I talk to know that stem cells too new to be covered by insurance. But I want to talk to you about this a bit more because this is an important point when it comes to any facet of your health. This is a concept that I really want you to understand. If you want quality care for a chronic condition, like pain, all right, then you're going to have to think outside of your outside of our insurance-based healthcare system, outside of that insurance model. You're going to have to pay for some of it. And really, honestly, why wouldn't you? All right, I know your insurance costs you money, but your insurance company doesn't pay for your mortgage, it doesn't pay for your car, it doesn't pay for your trips, it doesn't pay for your cell phone or your Starbucks coffee. It doesn't pay for a lot of things. Yet you buy those things because they're important to you. Folks, what's more important than your health? Okay? And I just want you to understand that if you want quality care for a chronic condition, you do have to think outside of that traditional medical, insurance-based, pharmaceutically driven model. Now, I can go on and on about that, but let's keep going here. How much does stem cell therapy cost? An injection in our office is $4,000 for one injection. For those of you who've done research on this, you're going to know that this is on the low end of the spectrum, right? In New Jersey, New York, stem cell therapy is $5,000 to $7,000 per injection. It is less for the second injection if you need more than one area. In Naples, Florida, it's as high as $9,000 or $10,000. Out in California and LA, same thing. So in our area, a range of $4,000 to $7,000 is pretty normal. We're so excited to be able to deliver this treatment, and we really want to make it affordable for patients. We're care credit providers, and we do work with other 0% interest finance companies. So we will bend over backwards to try to help you be able to afford this care. It's revolutionary and it's really exciting what it's doing. So the next question is, do we use fetal stem cells? Absolutely not. No, not ever. What can I expect post-treatment? The injection spot or the joint can be tender or sore, but you're not going to experience any downtime. Now you can't go out after you got a knee injection, for instance, and start doing CrossFit or Zumba the very next day. You got to give it a few days, but there is no downtime, folks. So what can you do to experience the best outcomes? Well, there's some guidelines to follow post your procedure, after your procedure, and it's good to stick to these for sure, all right? But my recommendation to experience the best outcomes is to combine stem cell with other therapies to get the best and most positive results. So the experts that have studied stem cell therapy for musculo-skeletal conditions said that the best thing you could do is combine other therapies. When we say other therapies, we mean rehab, exercise with the stem cell. Because as your body's healing, we want it creating new healthy tissue. So there's a lot that can be done, but if you want the best results, one of the most important things is to do the right rehab if you're getting stem cell for musculo-skeletal conditions. Stem cell therapy and cellular exercise, which you talked about, are absolutely a winning combination. And if you're interested in more information on this, we can talk more about it when you're in the office, okay? Okay, so in summary, here's what we covered, all right? What a stem cell is and what it does, where they come from, what treatments are available from our office, why we think this could be an incredible alternative to surgery, what the benefits of therapy are for a patient, and any contraindications. We also covered some frequently asked questions. So, what's next? What now? If you think you're a candidate for this care, I had a list of conditions that we work with in the office, and that's not an exhaustive list. There's lots of other things. But if you're looking to avoid surgery, maybe you're looking to get off medications, basically if you want to get your life back and get back to the activities that you enjoy, then please call our office. Schedule an appointment, okay? We will do a free consultation with you to go over your health history and determine if your condition might respond well to stem cell therapy. If after that consultation you'd like to move forward with a physical exam and x-rays, the cost for that's going to be $50, okay? Now normally that would be $249, but because you've watched this entire presentation, we won't have to spend the time in the office going over all of these details. That's why we're going to reduce the cost for it. If you're interested in a couple of trial sessions of cellular exercise, we can go over that while you're in the office as well. Folks, I encourage you, do more research on this if you like, but I want you to go online and look at the positive success stories that stem cell clinics around the country are seeing with this type of therapy. People are truly getting their lives back. People who could never conceive of running again are out running. People could never conceive of going up and down stairs. Women who couldn't wear high heels because it just hurt their ankles so much or their knees so much. Men and women who had torn rotator cuffs who had failed surgeries are getting their lives back, getting their use of their arm back, throwing a baseball with their kids again. It is truly miraculous what people are seeing from stem cell therapy. Give us a call today. Let's get you started on the path to regenerative healing. Folks, I appreciate the time you've taken to watch this presentation. I hope to see you soon.